This is the chief on call returning your page.
Hi. I am the MICU resident. I know it is 10 p.m., but I wanted to make sure my patient was first on the list to transfer to medicine tomorrow.
Just call me in the morning and we'll see how the census is.
But Edley told me there's a list, and I want to be at the top of the list.
There is no list.
What do you mean there is no list?
I'm not a bouncer. There is no list.
Are you sure there's no list?
There is no list.
But I heard there is a list.
There really is no list.
Really? Are you really sure?
Goodbye.
Observation resident here. I'm sorry to call you, but I had a quick question for you.
What's going on?
So the ER is trying to admit vertigo to me here in observation. I just went on nuts and bolts and I don't see vertigo on the list of diagnoses. What should I do?
There are a lot of diagnoses that are not on that list, but if you think the patient is reasonable for observation, you can admit it.
But what if she has really bad nausea?
That's okay. You can give Zofran.
But what if she gets nausea and vomiting? Shouldn't it go to higher level of care?
Not necessarily.
But what if she has nausea, vomiting and doesn't want to eat?
You can be NPO on observation.
This is a lot of information to handle right now. Do you want status updates for transfer to medicine? I can page Q 4 hours.
No thank you.
So I'm on hospitalist and I got called for an admission. I have a logistical question for you.
What's up?
The ER called me for an admission. The patient's blood pressure was 60/30 and pulse of 40. Alert and oriented times 1/2. It ended up going to the MICU. Should I count it toward my cap?
Did you evaluate the patient?
Well, I got a pretty good glimpse of him as he rolled out of the CT scan. I printed out orders for him too.
Did you write the orders?
No, but I thought about writing orders. I intended to write orders. Should I count the patient?
What does your heart tell you to do?
Well, in my heart of hearts I know I could probably get more learning if I took another patient.
Then you have your answer.
But I saw him. Isn't that legit? I think he had brown hair.
I'm going back to bed now. Listen to your heart.
Please call regarding MICU transfer to medicine. 86-year-old with sepsis from a decubitus ulcer. Now on floor bed for 8 days getting wound care and PT. Hi. CCU here. Can we transfer 32-year-old male with massive 20-centimeter cardiac sarcoma to medicine? He was admitted for chest pain and troponin of 0.11 and now needs chemotherapy. Thanks. Hi. Observation resident here. 57-year-old male with alcoholic cirrhosis, acute confusion, GI bleeding, and non-STEMI admitted to observation 3 days ago. I think he should be on medicine. Please call. Hi. I am CS here. I have 3 failed liver transplants who need to come to medicine. Please call. Hi. FYI, I am on long call and we can only take 2 new patients. I hope it's not a problem. Bye. Bed control here. Just FYI, medicine is capped for the next 5 days with 71 holdovers. This is Mojo. F this. I quit.